Am I audible or very low voice?
No, it's fine, sir. I think that's fine.
Hi Neha. Neha is from? Neha, David. I can see only four of them.
Good evening, sir. I am from GDC Indore.
David from?
Yeah. Okay. Okay, sir. So the meeting is on YouTube right now. Okay, great. Fine. All right. Mhm. Okay, so let me just give a quick introduction. Good evening, dear participants, everyone who's joined us here on this Wednesday evening. In fact, we've titled our Wednesday sessions as Wisdom Wednesdays because we are having expert faculty from public health dentistry across the country. Today, it's again indeed my pleasure to introduce to the learning group Dr. Shodhan Sir, who's presently working as Associate Professor in the Department of Public Health Dentistry at STM College of Dental Sciences, constituent of the STM University, Dharwad, Karnataka. As all of you are familiar with the way SDM Dharwad has been, really pinnacle in various programs related to oral health promotion and dental public health, especially since we've heard from many people who happen to be alumni of the prestigious institute. In fact, I had the pleasure of meeting Sir personally in his department, just a couple of months back. And very unique features about STM University is actually commendable in terms of the way public health dentistry is taught and practiced there. So I'd like to welcome Dr. Shodhan Sir to our panel on behalf of everyone at PhD 101. And this is indeed, a small way of saying thank you to Sir for having taken out time in tackling a very important subject topic for today, which was social sciences in dentistry. Now, a little bit of background about this, the importance of sociology and the various social sciences, in fact, it could be psychology, political science, and so many other domains, has been very, very closely interlinked the way oral health behavior and practices have shaped across the country and globally otherwise. For undergraduate level as well, we've noticed that we have a lot of questions commonly asked from this unit, which we shall be covering over the next 45 minutes to an hour. We shall also be having a special Q&A session towards the end where y'all can put in questions, any doubts you'll want to clarify. For the postgraduates who are attending this, again, I'm sure this will be very helpful because it happens to be one of the most favorite questions among the examiners. And a very, very small bit of trivia is when our specialty evolved, it was originally called as preventive and social dentistry. So from social dentistry, today we have come to public health dentistry. So there has been a huge change in the curriculum. So many concepts have evolved, and we've been realizing the importance of social sciences as day progresses, in terms of burden of oral health and how do we plan programs and all this and more. So thank you so much, Shodhan Sir, for taking your time and for doing this for us. And once again, I think I'd like to welcome Sir, and I request Sir to please take over the proceedings from here.
Okay. Good evening, Denzi, the director of PhD Online 101 series, and all the esteemed postgraduates, student friends, and my friends, staff colleagues. It's indeed a pleasure to be here a part of PhD 101. Actually, Denzi, we had planned, I think, 2 months back. The same thing. I was busy with the PhD defense, so I could not do it. So thank you for calling me over this. Again, once again, I welcome you all to this small session. Whatever small I know about social sciences, I'll be briefing you about around 45 minutes to 1 hour. Then shall we start, Denzi, or to anybody to join?
Yes, I think you can start.
Okay. Okay. Good evening once again. I welcome you all to my topic entitled Social Sciences and Dentistry. ಇದು full screen ಆಗಿಲ್ಲಲ್ಲ?
You can put that to full screen. Yeah. All good. Please continue.
Yeah. Fine. This itself shows us in sociology, everything encompasses sociology. So whatever you feel, it will be in the part of sociology. So we all know we've been called as a social animal. I think there will be I can't ask questions also here. I think it will be monotony. One side I should speak, isn't it, Denzi?
You can interact. I mean, just take some time, and participants can use the chat box as well.
Yeah. So it's rightly said, man is a social animal because health cannot be isolated from social context. Last few decades, social and economic factors had an impact on health. Social encompasses anything: culture, taboo, acculturation, everything comes under sociology. So we have been called as a social animal because it is difficult to isolate us from social context. Social, economic, cultural factors have much influence on health. Even family, personal relations, everything has an effect on health. This photo shows us the family as well as economic issues or the culture. It has a tremendous effect on health. So that's why we patients we can't consider them as one who is under strict laboratory control. The figure itself says that there should be proper understanding of health and disease in a person is essential. So again, there are a few slides which can show us about the culture, what is prevailing in India: poverty, increased population, tremendous stress, the culture parasity which prevents us from taking of many of the treatments which I'll be covering in future slides, and poverty especially. This shows us the disease is usually seen among minute. This figure shows about the disease which is basically seen among the poverty people um, because of the economic or social factors. So usually social factors encompass among poverty as well as culture. As we all know, modern diseases basically called as cardiovascular disease, cancer, diabetes, mental illness. These all are causing because of psychophysiological stress. So these all are the major reason. Whatever tablets we prescribe, it's not coming down because of psychosocial stress. Is directly studies have shown that there is a direct correlation between psychosocial stress and cardiovascular disease, cancer, diabetes, and mental illness. So it's been shown that clinical medicine, yeah, no doubt it decreases all the above modern disease, but still it is not only by miracle care but also changes in basic behavior and habits of the patient. I think this is visible to you all now.
Yes.
Yeah. This is a proverb says that good doctors are being identified as those who treat bad people and bad ones as those treat cases. So people, what usually they say, listen to what I say, don't do what I do. So basically, they listen to bad doctors. If they good treat good cases, they are then called as good doctors. So basically, why I was showing all these things is in the era till 1882, the phases of public health, what we know, 1882, 1920, 1920, 40, then 60 to 80, we had social engineering phase where social and behavioral aspects were given a new priority. Social and behavioral aspects were given priority in 1960s to 80s. So let's brief. I will not go into much detail. Let's go to brief about the history of sociology in India. So history of sociology, study of sociology came into existence in India in 1919 at the University of Bombay. This study is mainly pertain to Indian villages. Oh, this is again these studies pertain to Indian villages, caste system, marriage, family, and disorganization. So in 1919, they started studying about the Indian villages, the caste system, the marriage, the family, and social disorganization. These are the following changes. Basically, this is about dental dentistry and sociology and dentistry. So I just thought let's a bit discuss about patterns of changing society and patterns of dental disease. So before pre-agricultural times, there was the diet was non-refined, coarse, and attrition was severe. As well. Then the post-agriculture time, that is end. There were sugars coming into existence, which was refined only to the rich. So there was whereas non-refined sugars among the poor men. So there was increase in dental caries among common man when sugar was within reach of common man. So this is a brief pattern of dental diseases. After that, now let's see what is actually social science constitute of. So we have five parts in this. That is economics, political science, sociology, social psychology, and social anthropology. So last three constitutes up to behavioral sciences. So it's brief 3 4 slides about what do you mean by economics, that we all know that is deals with human relationship in specific context of production, consumption, and ownership of scarce resources. So basically this is about the production and the consumption and ownership of scarce resources and goods. This all we know political means system of laws and institutions which constitute the government of whole societies. So this is basically with the laws of the system of laws and institutions. Then we come to the term called as sociology. That is what is required here. That is study of human relations and human behavior. Then we have social psychology, where this Dense, I'm going a bit fast because these are not much of importance. Just a brief gist to start the proper.
Sure.
So social psychology is mainly concerned with psychology of individuals. Basically this what I want to tell you is last three, that is living economics and political science. Sociology, social psychology is basically taken into consideration. That is psychology of individuals deals with the effect of social environment of persons, their motivations and attitudes. This also is one of the most interesting topic called as anthropology, where we usually study of physical, social, and cultural history of man, how our evolution from animal to man, and again we are going into that state. Now let's start with sociology. That is, sociology came into existence in the year 1798 and 1857. So socio basically means is usually many of the terms have been derived from Latin word, that is social means society, and logos means Greek word that means science. So that means is called as science of the society. Sociology is nothing but science of the society and the group of people who are having the same common intelligence will form a group, that is social group. Now before starting exact sociology, let's see how does it affect on health, that is social and structural factors. So this slides shows us how social and environmental factors, like for example there are predisposing factors like current circumstances, like am I audible, is it slow? Hello?
Yeah,
Like
yeah, 100%.
yeah, predisposing factors like it suggests that is health is influenced by four set of variables, that is individual perceptions, current circumstances, ecological predispositions, and opportunities. Opportunities like access to health services, exposure, pathogens, availability of education, food, sanitization, alcohol, drugs, and marriage partners. Whereas current is nothing but it equals with income, life, family life, house, employment, stress, and crisis. So this has an effect by the social structural factors. That is either it might be demographic factors, economic factors, political factors, educational economical, then like urbanization, marriage, life expectancy. So the basically what I mean to say is this chart, what does it show? It's been taken from Park. Where does it show that the current circumstances, individual ecological opportunities are all predisposing factors, and among that social factors are demographic, political, legal. This all has an effect on health. Let's see how does it affect on health. So basically, before starting that again, let's see what do you mean by society. As I already said, a group of individuals organize themselves and follow a given of life. Now, before starting sociology, as I already said, there is a group of individuals who have been We are according, they have the same intelligent level, they organize themselves, they follow a given life. That is society. And the outstanding feature what comes out of the society is the system. So now the actual sociology starts now. So let's see what do we mean by custom. As we all know, custom means it has been transferred or been transferred from generations to generation. Like for example, easiest example is brushing or doing namaste, because it has been transferred from generations to generation. Our parents, our ancestors are doing that, and we are doing that. That is refers to the practices that have been repeated by number of generations, practices that tend to be followed simply because they have been followed in the past. So that is the way of doing in the community. Usually in culture, again we have two things, that is folkways and mores. It's nothing but culture only. Culture is nothing but passed on from generations what has been practiced from the past. We are not going to ask them why we are we doing that. We are just practicing it. That is culture. Whereas in culture we have two things called as folkways and mores. That is, folkways is we are doing out of fear. That is like dressing, the way we eat, the way we greet. That is customary ways of behavior, not done out of fear, but it is the situation. How does we do it? For example, doing namaskar or brushing or eating anything. So the customary ways of behavior which is done out of fear is folkways, whereas the right ways of doing things in less vital areas of human conduct, but may cause the person to be laughed at. This is folkways which is done without fear, where with strict results is done in is called as more. That is more stringent custom. That is, for example, yeah, when we go to temple, we have to say, leave our footwear, slippers outside. That is more stringent customs. That is socially acceptable ways of behavior that involve moral standards. For example, parda system or go, as I already said, going to a temple without with chappals is all taboo. Whereas if more are following, it is nothing but more. When it is strictly followed, it will be converted into rule. So that means as socially acceptable ways of behavior that involve moral standards. Rules are nothing but important mores are converted into laws to ensure their implementation. So till now we discussed about, to just a recap, that is in social sciences we have political science, sociology, social psychology, anthropology. So the last three we are going to discuss, that is sociology, social psychology, and social anthropology. In that sociology, in sociology we discussed about culture. In culture we discussed about folkways and mores. Then let's see what do we call by taboo. That is, taboo is nothing but a strong prohibition or a ban relating to any area of human activity or social concern. For example, alcoholism is a taboo in some religions. If we continue that, then it will be taboo. A taboo is a strong social prohibition or ban relating to any area of human activity or social custom declared as sacred for and forbidden, and breaking of taboo is usually considered objectable by the society. Then let's see what do we mean by culture. Culture, as already know, it's a learned behavior. It's nothing like it goes in parallel, hand in hand with the custom. That is learned behavior which has been socially acquired. That is nothing but it is the central concept around where cultural anthropology has grown. It can be defined as learned behavior which has been socially acquired. So culture is the product of human societies, and man is largely a product of this cultural environment. So the culture is transmitted from one generation to generation another through the learning process, as it is been transferred from years or generations. Either it might be formal or informal. It plays an important part in the human societies. It lays those norms of important part in the behavior and provides mechanism which is secure for an individual as personal and social survival. In general, we can say that culture stands for custom, belief, laws, and moral percepts, arts, and other capabilities. So, culture has a major role in health and disease. It is a major factor in health and disease, which has created a lot of attention among the medical scientists and the sociologists. Every culture in every culture has its own custom. In this only we can see 3 4 figures where they greet each other. Mother daughter is depicting her mother and the parda system. So this is the culture in which India is having very diversity of cultures in one nation. As I said, it is transferred from generation to generation. Either it might be formal or informal. It lays down of norms of behaviors and provides mechanism which secure for individuals. I'm just briefing you 2 3 slides how culture varies and how we are getting addicted to different types of cultures. So culture is having a tremendous effect on health and disease. That is, in developed countries, we have smoking and alcohol, and we all know what happens about smoking and alcohol if it crosses above the limit. In developing countries like us, pan chewing. This is a small example which I have given in which the culture is affecting our health in the form of a disease. See, these are the few slides where we can see a few cultures where there is increased amount of nails and actual proper culture, how proper thali is being served, and in the developed country, how the culture has changed, and we are also getting evolved into that same culture. Also, we can see how we greet here. We can see how we greet here and how the technique new greet has come. After that, again, we are going to back. That is the same namaskar we are doing in this COVID era. So we had a good culture which has to be followed, which has been decreased. Let's see what do you mean by acculturation. It is very simple. When there are two different cultures joined together, it is nothing but acculturation. The photo itself shows how culture has been mixed and there how they are trying to depict each other. So it's a process of individual or group adjustment to a new culture as a result of continuous contact with the culture that is different from culture of origin. That basically it means as culture contact. So when there is contact between two people, as we see in the first slide, with two people with two different types of culture, there is diffusion of culture both ways. Either it might be to trade and commerce, or industrialization, or propagation of religion, or conquest, anything. For example, we are into acculturation phase. That is, British brought their culture into India through conquest, and Indian is to be said the best next Englishman. It is because of the cultural contact which has both good as well as bad aspects. So usually, individually, typically undergoes psychological, behavioral, and attitudinal changes which will affect psychological and physical health. Either he'll get addicted to few things. So this is basically the mix of two different cultures, which is having an effect on health and disease. So there are few slides how families will cause an effect in health. That is the 2 3 slides are there which I'll quickly go through. That is nuclear family. As we are will see, we all know what you mean by nuclear family. That is elementary family, married couple and their children. Husband will have a dominant role. Husband-wife relation is more. Whereas joint family is Indian tradition. We have more extended family. That is common in India and Africa, where India Orthodox Hindu family, joint family is related by blood. The senior male is the male is having the more authority, and property is held in common. So this all has a tremendous effect on oral health as well as health. So this is three generation family which is seen in the West. That is representative of three generations. When when young couples are unable to find separate housing accommodation and continue to live with their parents, they have their own children. So let's see some amount of cultural factors in health and disease. Uh, Denzi, am I going fast? Because
No, it's okay, sir. It's fine. The pictures are very explanative. Yeah.
yeah, because I can't have two-way sessions. I don't know how is it going. First of all, second is this is a bit dry and volatile topic, as we all know. I am trying to make it a bit more interesting
Yes.
by adding colors. That's all I have tried a bit.
Please continue,
Before,
sir. Please.
yeah, these cultural factors in health and disease. That is like I think we all know of the concepts of etiology and cure, environmental sanitization, food habits, mother and these are all the cultural factors. I'll show how does it affect. So this is I think most of them have experienced supernatural causes. That is wrath of God or Choti Mata or Sharp or previous generation ka sharp is for invading us, or invasion of body by evil spirits, and influence of stars and planet. So we all get checked by the astrologer, we get puja done. These all are supernatural causes which we have a belief, and obviously there is cure. It is sensitive to say that it doesn't have any effect. So there are supernatural causes which are having a tremendous effect on health and disease. This is the way how culture is affecting our health. And physical causes which is unpreventable, that is weather, water, impure blood. So this is environmental sanitization, that is disposable of human excreta, disposable of waste, water supply. This all has an effect on health and disease. So these food habits like for vegetarian and non-vegetarian, fasts, drinks and drugs tabooed in Muslims. So this, what I want to show here is these are the few slides in food habits, especially like many people have the habit of having in same common utensils. And in this pandemic era, we know how to maintain SMS or whatever. But before that, this culture had a tremendous effect on health. That is eating and drinking common utensils. Hindu women usually take food left over by the husband. And we drew fasting, and 1 month fasting people do. After that, there is tremendous effect on health. Vegetarians have their own effect on health. Non-vegetarians have their own effect on health. So these are the some food habits which there are many issues, but few things according to UG level which are important I have put up here. So this has an effect on health and disease. In mother and childhood, what they say, what Indian traditions say, good culture, I mean to say, they say prolonged breastfeeding. Prolonged breastfeeding has a good, they say they get good oral health. Oil bath, these all are good, what we can say, these are all good things which will help us growing better. But there are some bad things which are affecting health. That is, some foods are forbidden. They think it will affect our health, and they in the village areas they get usually delivered done by traditional untrained guys. They feel them as lucky as they have been seeing them from many years. This is bad. Whereas some unimportant things like punching the air, I think we all have experienced that punching the air the moment there is a growth of baby child, or their male or female, or the nose, or also an application of oil on the frontale. Uncertain is these are four issues which is given in park, that the only good thing is prolonged breastfeeding till to 3 to 4 years and oil bath. Then we have bad, then unimportant and uncertain. That is applying kajal to the eyes. These are the four things which I wanted to stress upon. That is cultures which are one is supernatural causes, as I said, like before the smallpox and chicken pox, they used to say because of wrath of gods or goddesses, or Ma Sita Devi Chuti Mata, as I said, leprosy, tuberculosis. They used to say that this is due to supernatural causes. Then we had environmental sanitation, food habits, then mother and child health care. Then in this personal hygiene, I have only taken about oral health. There are a lot of things which has to be discussed, but as we have only one class in oral hygiene, I have taken into consider that is Indians particularly use twigs to brush their teeth in rural India, ashes, charcoal, and they are used to eat pan with the lime with or without tobacco. Only oral health I have taken into consider, that is smoking, reverse smoking, which I think many of them see in the cases or read through literature that reverse smoking has a tremendous effect, especially tobacco has an effect on health, reverse smoking has on palate. Let's say about social class, they say we are one, but yeah, are we really one? Edwin Chadwick in 1842 published a series of tables illustrating the connection between mortality and social class. That is, there is a lot of mortality cases in lower social classes, and the pattern is still found same today. In 1842, he had published this series that mortality cases are high in lower class. That is, there is a lot of now number of inequalities related to health. For example, income, occupation, and education positively correlated with health status. So high income group, high society have a better health, and upper social class, they have longer life expectancy, less mortality, a better health and nutritional status. Whereas lower middle class or middle lower class has an more about morbidity rate as well as mortality rate is more. Usually, even I can't say only morbidity mortality rate is more. Even in high say, social classes, there is high incidence in social classes, life related, lifestyle related disease. As I said, the habits which we get imposed to, that is also having an high incidence in social class. Whereas lower classes is disease of skin, eye, and ears, diarrhea, and dysentery. Now let's see how social, cultural, and economic. So till now, what I discussed was about. Till now, what I was discussing about is I can directly go to dental issues. So before that, I had to tell about what is custom. What is in custom? We have focused to more. I'm just summarizing things. Focus most. Then we had culture. We had discussed about acculturation and how. Actually, I have skipped few things. That is family in health and disease. I only discussed about culture. How does it affect health and disease? In culture, about supernatural causes, physical causes, environmental sanitization, and about classes. Now whatever is social and how does it affect dental care? We are not only responsible for mouth but also to a patient. Now when we come to dentistry, now we should think as a dentist, what makes the patient sick, or why do they come at the last minute? That's called as last ditch effort, which I'll be discussing in future slides. So why is he or she sick? What is his attitudes towards their teeth? How were these attitudes formed, and can they be changed, and if so, how? These are the social things which have to taken into consideration when the patient comes to you. We need to know what social factors are relevant, how individuals are influenced by their upbringing, how we can best communicate with different groups, and so on. Before that, as I already said, there are classes in sociology, that is upper middle class, lower middle class, and upper lower class, lower class. But I have taken only difference between two classes, that is lower class and middle class, and their reaction to dental treatment. If I go to lower class, high dental treatments needs low dental visits. For example, the poor lower class people, if they have problem, they don't go to visit dentist. If it is at the last minute, they go. Whereas in middle class, mothers visit dentist and take children to the dentist at an earlier stage. Whereas for lower class, it has been the treatment has been done at community dental centers where condition is severe. In the middle class, general dentist practitioners will treat the case. Whereas in lower class, fewer referrals for specialist services. Whereas in middle class, referral for specialist services. At the end of the day, they favor for extraction of deciduous tooth, as they say that however permanent is going to come. Whenever it comes, no matters, they end up in extraction of deciduous tooth. Whereas in upper middle class or middle class, they will be favoring restoration of carious tooth. When we discussed about upper lower class or middle class, we had to discuss. We also should discuss about Trihard what he gave in 1968 about lower middle class people or underprivileged people and their attitude towards healthcare. So these are the social things which he has taken into consideration among, especially among underprivileged people. That is castration complex. That is the patient is reluctant to be at complete mercy of the health practitioner. That is, he is marked by reluctant to have a general anesthesia or sedation for dental or surgical procedure. He is totally reluctant, he or she is reluctant to be at complete mercy of the health practitioners. Then one more what he said was contradiction of common sense. Like some dental or medical procedures such as continuation of drugs after acute symptoms have subsided seem to contradict common sense. That is, even after acute symptoms have done, they continue the drugs. It is recommended that a common sense approach rather than a scientific approach you are going to give full course. So it is recommended common sense approach rather than scientific approach should be used in dental advice and dispensing drugs. And there are some people who come to dental treatment in crowds because they don't not like to be outnumbered by the people providing treatment. For this reason, they tend to come in crowds with family and friends, as visit to a private dental office may be a terrorizing experience for them. So usually in villages they come in crowds. For one patient, a group of people will be coming. This is what a few issues which Trihard has mentioned, and it is the same what he has mentioned in 1968. It is the same now also. Even as I mentioned, last ditch effort. That is, after all things, even if pain is there, they'll keep. Think you all know clove oil, or think you all have experienced applying Vicks or cold, whatever it is. After everything, if the pain doesn't come, last resort, that is, they'll come to us. That is, the disadvantaged individual often turn to medical or dental treatment by health provision as the last resort after all individual efforts have failed. They are, in a sense, challenging health professionals to salvage something from an almost hopeless situation. When they have finished all things, then they come to us. Okay, if they come to us and if we provide treatment and if we hurt them, they say we are a quack. That is, the group or that lower people have a general feeling that medical and dental treatment should be painless. Even injection when you give, they feel that it should be painless. And if you are going to hurt them, then that means that the health practitioner is a quack. These all are social issues which we encounter in dentistry. So before that, I was just conveying about the public health. Now in dental public health, always it's been said or they think like that going to a dental clinic is unclean or dirty feeling. That is, aseptic cleanliness of a dental office or clinic may convey the feeling of personal uncleanliness. The feeling may be reinforced by the dentist washing his hands after he treats the disadvantage. For example, if I am doing a patient, after that, when I am going to treat next patient, that underprivileged people think that I have not washed my hand and I am not clean. The same disease what I had treated in the previous will be transferred to him. So they have a dirty feeling. That is, they may be reinforced by the dentist washing his hands after he treats the disadvantaged person. Such simple procedure as should be explained to them. And there is something called as why I should go to that clinic. Let that clinic be near my house. The clinic was built there, not here. Because many health facilities or hospitals are away from the city, and it inconvenient places for the underprivileged. And many of them tend to think and say that if you really cared about us, you would have built the hospital near my home or the clinic near here instead there. So these all are the factors which are make they say that it is preventing them to get the treatment. Then there is also called as something called as difference in pain threshold. Usually some people have high pain threshold, some people might have less pain threshold. That is wider variation in the pain threshold of the disadvantage than in the population in general. The pain threshold for those in poor health may be low. Patients should be prepared. So what I mean to say or what we are discussing is we have to assess or gauge the pain threshold among the patients. We have to properly educate them about the pain. If they have high pain state, if their pain threshold is low, then we have to explain them properly. This all, if we get to know if a proper case history, we can provide a treatment. Also, there are few issues. Whenever any I think we all have experienced that we start giving with the lower antibiotic. If the pain doesn't come down, then they start blaming the dentist. That is, the pills don't work, doctor kotru ide kelsa aglilla. There is a tendency to expect immediate results. I think we all have experienced that. Immediate gulge kotta takshana within 1 hour the pain should come down. They want immediate results from administration of any drug. Any time lag between administration of a drug and relief from symptoms may be considered as a failure of drug, and its use may be discontinued. If it doesn't work, then the dentist is not good. Also, there are issues called as appointments. Say appointment ಏನಾಗ್ತದೆ, let's miss it. But we appointments are not important. This is all about underprivileged. I am very clear about discussing these are attitudes of underprivileged people towards the healthcare. Appointments of any kind have never been an integral part of the lives of the underprivileged. There is no reason to expect them to consider dental appointments as a mean of conserving their time as well as the practitioner's patience and understanding. So they don't know the value of appointments. I think I don't know whether extra slides are put. There are many other slides. For example, cold professional attitude. Like many disadvantaged people complain about the cold, impersonal, objective attitude and conduct of health professional. They feel we have a cold attitude, we are impersonal, how much we care. They feel we have a cold professional attitude. They value empathy as well as professional competence as essential characteristics of the practitioner. And also, people when tooth are lost, they say, "However, I have lost the tooth. Why I should bother? Tooth lost anyhow. However, I am going to lose the tooth. Then why should I bother?" There is a feeling that despite competent and consciousness personal and professional care, the ultimate loss of teeth is one of natural wastage slides of life. But they think that however tooth is gone, nothing to worry. And also traditions also play a role. Contrary to some beliefs widely held by the more influent segments of our society, impoverished families and neighborhoods have strong and deep safer traditions. Till now, we discussed about culture, about trihard underprivileged attitudes toward. Well, this is now we have some issues, some slides, how culture is having a role in dentistry. For example, I think many of them have experienced too. Mutilations of teeth are seen in tropical regions. That is not therapeutic extractions, non-therapeutic tooth extractions, crown shape alteration, chipping, staining. So these all are practiced in tropical regions. Tooth evolutions in Australian Aboriginal tribes and Africa. There is a ritual tooth mutilation for spiritual reasons. And in country Varusha and Masai people, they remove the permanent incisor because in future, if the patient, I mean not a patient, if he or she is not able to open the mouth, the space will be allowed for passage of oral liquids. When the patient is normal itself, they remove the two permanent molars. I could not find the photos. They remove the permanent molars so that they create a space to pass the oral liquids. And I think this all we know, dental inlays and crowns. These are seen in Maharajas and especially rich people and tattooing. And now it's a trend where they put for a canine, they give pearl or some restorations and the anterior, which is it's aesthetic. That is a urban trend. Whereas in old ages, dental inlays and crowns were given among only gold inlays were given among Maharajas, tattooing and piercing of lips and perioral tissues. And these are the few photos which I got to know. See, this is the typical this one where they have given full crown at the anterior level. This is also golden crown. These are typical old ancient photos which have been downloaded. In this, we can see the crowns which has been chipped or is given peg shape like shaped incisors. Here, they have given a vertical lines like this. This is the culture in dentistry which was practiced in the past. Here we can see the lateral how the crown is given. Here we can see how they have done here. In this we can easily see how the incisors have been shaped. Here this is tattooing and staining of the tooth as well as the gums. So this is the these are the few things which have been usually asked. How does culture vary in dentistry? So now we are going into aesthetics. This was practiced years ago. So this is what this shaped laterals, and here also we can see piercing of the lip and staining of the tooth, the change in shape of the anteriors. These all were practiced as a culture in their tribal regions. It is not aesthetically, but these were the culture which was practiced. Till now, I discussed about the culture. Before that, underprivileged attitude towards oral health. Around 6 to 7 factors, that is last ditch effort, coming in crowds, clinic is built here, not there, cold professional attitude, and etc. Then I discussed about different types of cultures, what all they do with the oral health, and few. I think these all most of them are postgraduates. There is nothing to mention here. In taboos in dentistry, as I said, it is banned in what is taboo? I told you initially. When I was in UG third year, I got a first patient of this only. When I was about to convince in the extraction, he said that if hal ತಕೊಂಡ್ರೆ ಕಣ್ಣು ಹೋಗುತ್ತೆ. So this is a common feeling in this country. I don't know in Himachal Pradesh, like Deepak, David, or whoever is there from there. I don't know whether they experience the same thing. Here they say that if we are going to extract the tooth, they say that there will be loss in eyesight. Basically, what happens is when we give injections, if empty stomach, we know what will happen. Either syncope. They think that eyesight is lost. Or else in near in North Karnataka areas, whenever decay tooth, when a rural underprivileged people come, the dentist should show the worms after removing the decay. Because they go to quack, what they do, they put some, this what we have experienced when we went to camps. They put some cotton in the ears and they show some worms in that. So they are under the permission that decayed tooth should. Then this all I think we also practice that when the deciduous tooth exfoliates among our kids, we also throw out to the rooftop, thinking that how the roof is so strong, the tooth also should be so strong. The future tooth which is coming, we keep below the pillow, tooth fairy, isn't it? Or at the garden we throw, or at the rat hole because the rat they say that its teeth is very strong, so they keep at the rat hole. These all are taboos which is being prevailing in this part, and they have a issue that if we do oral prophylaxis, the tooth will become loose. And most importantly, what I found out in the evening was the child who is born with neonatal teeth, they say that there is something dangerous going to happen to the grandparents. So these all are the taboos which I've been seeing and which still we practice. The last but second deciduous tooth exfoliation we also practice. So these all are sensitive issues which are cultural, which being followed from the past. So here we are correlating culture because it is passed it is passed from the generation. Same thing we are following. So this what I mean to say is there's sudden abrupt in the slide. Few slides not seen here. That is inverse care law. That is, it says that availability of good medical training is to be necessary. That is here, the urban has lot of resources. This is also given by Tudor. He says that urban has lot of resources, but disease load is less. It has to be vice versa. That is, urban has more disease load, but resources are less. Same in holds good in the prevention. So the upper class always gets better benefit from the preventive program, whereas the disease load will be less. Lower class has more disease load, but preventive program is very minimal. There are some barriers among which prominent is which we can change, but it's not possible to change. That is intake of sugars that is accepted whenever we go to a function, or we use it as a gift reward, as a token of appreciation, like a sweet box or chocolate box, as a let it. Sometimes it might be as a bribe or a pacifier at a positive reinforcement to patients. These are the we are only giving them uh, the reward, but it is an accepted social norm. To rewind or recap, I would say that social environment is does have a to recap, I must say that social environment has an important role in relation health and disease. By understanding different social sciences, we can predict culture of the concerned society and provide proper care. Health behavior has a direct and indirect effects on health. Thereby, we call upon social scientists to aid in program planning and evaluation problems. Also, there are health habits which can influence either health either positively or negatively. If it has a negative, then it affects health, like these issues. If health habits are developed early in childhood because of social and cultural norms, although habits are formed at an young age, they can be changed with new information and individual motivation. To conclude, this will conclude, its knowledge will help better serve the individual or group they deal with. For social sciences, only social science, a holistic approach makes our approach more holistic. Thank you. Any doubts, Lindsay? Am I fast or on time?
Okay, sir. Is that the last slide, sir?
Yes. Sakala. These are the reference.
Okay. References.
I don't know whether this is, I have deleted that slide. Questions which was asked, I think that is for our students, which I usually say.
Okay.
And I have deleted that. Yeah.
That's okay, sir. Yeah. Okay. All right, participants. Yes. So that was social sciences and dentistry. Again, a very, very vast topic because of the nature of the topic, where it goes that everything is again going to be affecting the population. Okay. From the exam point of view, again, quickly just giving you a note of all the questions. Social determinants and health and oral health, commonly asked questions as acculturation, then the attitudes, what Shodhan sir mentioned, commonly what patients think of dentists, the underprivileged class, the perceived notions. There have been a couple of questions related to the myths and the disbeliefs and the taboos in dentistry. That's also asked for a 5-mark question. Like this, there are various other topics which were covered today. And I think that gives you a brief overview of the entire topic per se. All right. So now quickly, if I could just open this up for discussion. Yes, participants, I think anybody, if you all have questions, please raise your hand or please do unmute yourself and go ahead. Yes. Yes, Dr. Deepak, go ahead.
Sir, can you recommend a book on medical sociology, a standard book to refer?
Park is better. Park. Bible, you can say.
Okay, only for medical.
और एक है महाजन करके है, महाजन, it is also good.
No, sir, in particular, only for medical sociology only, sir.
Park is much better. Park, in that we have medical and social science. You can refer textbook of Park latest edition.
Okay, sir. Okay, thank you.
Yeah, Dr. Deepak. In fact, Park is in the most important reference because everything stems from that. There are a couple of books where they talk about sociology in oral healthcare. To a significant extent, I think what Sir had already added in his slide, Cynthia Pine is a very good book for oral health sciences, sociology. And you can also find some quintessentials, short books which are there, which talk about social sciences, and many editorials and commentaries which come related to social sciences for preventive and promotion and various other aspects. Okay. All right. Any other questions from our participants before we could just wrap this up for today? Yeah. So please let us know if you have any questions. We'll be more than happy to reach out to you. Again, a quick note for the postgraduates. This is a very, very important topic. A lot of your answer writing stems from how well you've understood this, and that will help you deliver better, write your answers. And for the first year postgraduates also, a couple of questions on culture and oral health and anthropology is often asked. We try to, since do this, if at all you all require, we can always have another session. I think you can request Shodhan sir if we are needing, we would definitely accommodate another session for specific questions and answers on this topic. All right, so quickly just wrapping up for today. Thank you so much, Dr. Shodhan sir, for taking out time doing this for us. Really helpful because this topic, when we discuss this, right, social sciences is very, very vast and so exhaustive that it's really difficult to wrap this up in a very short time.
Actually, it needs more than 3-4 classes. I think we all know that. Just a few slides. I think I've deleted few slides in the evening when I was about to upload to you in the mail. I have tried to minimize it, which is more important to graduate level, as you rightly said yesterday.
Yes, sir.
Few slides, around 30-40 slides have been deleted. It's a vast, important, and it's a vast topic. It's not so easy to finish this in 45 minutes. I've tried my little best to help you all.
Okay.
I hope I have at least fulfilled few issues. And any questions, they can ping me or message me. And it was indeed a pleasure to be a part of PhD online 101 series. And we will have a good interaction in future academic programs.
Absolutely, sir. Absolutely. So thank you so much, everybody.
Thank you all. Yeah. Bye.
Just quickly mentioning, please do look up on our website. You'll find more information on the reading materials. We have exclusive programs for UGs and PGs. We have a Prime membership where you get exclusive access to a lot of content and teachers from across the country. And of course, the Wisdom Wednesdays will be there. So we have many exciting sessions coming up. In fact, a rendezvous special on fitness is coming up this Sunday for Independence Day, and followed by that, we'll get back to our Wisdom Wednesday sessions. So thank you all so much for joining in and connecting with us today. And see you all very soon for the next session of 101. Thank you so much, Shodhan sir, and goodbye, everyone. See you all. Thank you so much. Bye-bye.